I'm Dr. Gillian Kernahan. I'm President and CEO of St Joseph's Healthcare in London. What we found is we had a culture of people being nice to each other. People spoke to each other, people greeted each other in the hall. We actually have a nice culture where people are very pleasant to each other. But when it came to the tough conversations, when it came to holding each other accountable, people weren't stepping into those conversations. And they weren't, if they saw somebody doing something that was potentially put a patient at risk, they wouldn't necessarily step up and say so. So we were seeing our sick time rates going up, we were seeing our hand hygiene rates needed to improve. So we saw some of the markers both around the quality of care we provide and the quality of our work environment and our financial performance, as you can imagine with sick time, when we did not have people speaking up and holding each other accountable. It was congruent with our values. Helping people step up into respectful conversation focused on outcomes was congruent with our values. So that was probably the most important thing. The second thing is it was practical. It was something that people could grab and didn't need to be an expert in. And the quality of the training was attractive as well. The way it was put together from an educational approach, both with the videos, with the group learning, with the structured practice that really focused not on head knowledge but actually competency and capability, were all factors that made it attractive to us as an organization. So we started with leadership, and we started with our senior leadership team, and we trained them in crucial conversations and set the expectation of walking the talk. And so we trained our senior leaders first and trained a select group of our senior medical leaders, ones that we thought would be early adopters who would actually go on this journey with us of behavioral change. And then they became champions for this within the medical community as well. We realized if we were going to do cultural change, we needed to get our physicians involved because they're crucial members of the team. What we did was we trained some key medical leaders initially and then had them be spokesperson for the value and the academic excellence of the program. So we actually had our chief of psychiatry come to the training who spoke to the congruence in the academic literature of the Crucial Conversations training and the literature that was evidence-based, which also helped. So it dispelled that myth that this was just another training program, but this was actually grounded in good evidentiary practice. Physicians took their own time, and initially they paid for their own materials, and they still came for the training. And then when we signed the enterprise license with Vital Smart so that we train everybody, they still take their own time to come, but we don't charge them for materials any longer. The upside of investing in the culture and training your staff is that you see both the quality of patient care and the quality of the work environment improve. So our patient satisfaction rates across our organizations are consistently higher than our peers. Indeed, we were actually recognized in our acute inpatient area as the highest performing patient satisfaction in the province of all the academic hospitals. We received accreditation with exemplary standing in our last accreditation, which is a really quite an achievement as an organization as complex and diverse as this organization is. Our hand hygiene rates are now at 87%. We've seen our sick time come down. We've used Crucial Conversations to very specifically train our leaders in how to have those conversations with their staff that's respectful but outcome focused is what we're looking for. And our sick time has come down by about 3 days per FTE per year, which is a huge savings because a day per FTE per year costs us about $1 million. Our responsibility as leaders is to create an environment where people can do their best every day, and Crucial Conversations has contributed to us being able to do that.